So, my name is Maura O'Farrell and I am the Health Promotion Officer at the Sexual Health Centre. So I deliver youth sexual health workshops in a variety of different sessions. And today we're doing one virtually due to COVID-19, but hopefully sometime soon we can get back to doing some in-person workshops. I am just going to reiterate, I know some of you are here last week, so you might have come across it, but just to draw your attention again to our Sexual Health Hub. So on Instagram, we have set up a unique page for youth, so anyone 15 to 24, that is designed to basically answer all of the different sexual health questions that come up for young people, do different campaigns, and it also has an expert on it. So we'll run things like test your knowledge and different kind of questions and fun pieces to see what you do know or what you don't, or what maybe you thought you knew and it turns out maybe you weren't so sure. We'll talk about things like consent. We'll talk about how to use condoms properly, what to look for on the packet, and all the different things that come up like sexting or pornography. There is also a shift expert on the page. So what that really is basically like an agony aunt, or the idea that you can submit questions completely anonymously and have them answered by a professional accurately and with all of the advice that you need. So maybe if you need signposting to another service, that you'll get that as well along with the answer to your question. So we get a whole range of different questions that come in. I showed some of them last week, like where can I get the morning after pill? We get things around the different types of emergency contraception, how you can contract STIs, all different things like that. So if anyone comes across it, or if you'd like to give it an ad, please do. It's a great resource to have, and it links with all of the type of information that we're covering in these series. So the next part of today's session, we're just going to cover the content and what's covered in this webinar series. I think I have admitted everybody at this point. Now there'll probably be more people joining as we go on. In fact, there's 2 more in the waiting room now. Sorry, now 1 second. So I'm just going to ask everybody, if you wouldn't mind, if there's more than 1 person using your login or on the Zoom, if you'll pop it into the chat box, just so we can keep track of numbers of how many people actually attended the webinar. And that will give us an idea at the end of the webinar series, how many of the shift booklets we need to send out to everyone. So if you wouldn't mind, if it's 1, if it's 5, just popping that into the chat box for us so we can keep track. Thank you so much. So just to reiterate, today's webinar, we're doing relationships and consent. So we are going to look at relationships, different types of relationships, what it means to have a relationship with somebody, communication, consent, bystander intervention, which is a really important part around consent and what's involved in being a bystander and what you can do, sexting and the new laws around harmful communication or intimate image abuse. And then we'll open it up to a Q&A at the end where you can either ask questions in the chat box, or if you want to unmute yourself, you can ask them out loud. So that's our layout of today's session. So we'll get started. So the first thing we're going to look at today is emotions. So the reason I think it's important to cover emotions when we're talking about relationships is general, is we need to understand that as human beings, as people, everyone has an emotional range. So we can all go from feeling really low or sad to being really happy and excited about something, but there's a whole range there with a middle kind of point of just being, you know, relaxed, maybe not feeling anything at all. It is normal to feel low, to feel negative at times. So there might be times when you're just feeling a bit down. That's totally fine. If you're constantly feeling low and that mood doesn't shift, then that can be something that can be problematic. And it's really important you speak to somebody about that. But don't think that you're never allowed to feel down or sad or not okay, because you absolutely are. It's important that we recognize our own emotional ranges and reactions so that we can understand what triggers us and then how we become comfortable with that emotion. So for example, if I come home at the end of the day, my dog will greet me and that's something that lifts me up. So I'm always going to be in a good mood when I see my dog, and it's a trigger for me. It's something that I'm always going to feel positive around. I'm really happy feeling that way. But sometimes if I drive past, up until recently, say all the closed shops on Patrick Street and Penny's is calling my name and the doors are closed, that can make me feel a little bit sad, a little bit, you know, fed up with the world and how it's feeling. So I might be down the other end of the scale and around that. And it's really important that I understand why I'm feeling that way and what's going on for me, so that as a person, I can manage those emotions and think, actually, that's rational, Maura. We're in a global pandemic. You're okay. You're going to feel this way. It's going to pass. It's not forever. Allow it to happen. And when we understand ourselves and our emotions, then we can bring those to relationships and we can learn to express them and we can learn to use them to tell other people how we're feeling and about our emotions so that they understand what's going on for us. So it might be sometimes, difficult to express our emotions to others, but if we understand them, we're in a much better position to share that to somebody and to have a better relationship with them. So being aware of your feelings, learn to express them, and then you can understand how you feel around another person. So maybe they make you feel really happy, really excited. Or actually, maybe when you're spending time with somebody, you're not feeling anything for them at all, even though you're meant to be excited. And maybe they're saying things to you that are a little bit hurtful and they're making you feel down. So when we take time to sit back and think about it, we can often understand more about our emotions and how they're attached to somebody else. We can then start to think about the reasons for those feelings. So are we feeling really excited because they're, really kind to us, or they're encouraging us, or they're telling us things that we like to hear about ourselves? Or are they maybe saying hurtful things and that's why I'm feeling sad and that's why I don't really like being around that person? And how you communicate those feelings then to another person is really important. So sometimes just by actually opening up and saying it, someone mightn't necessarily realize that they've been making you feel a certain way or what that has in terms of its impact on your emotions. So understanding it and figuring out what your triggers are means you can tell somebody and maybe they didn't realize and they say, oh my God, I didn't know I was doing that. I absolutely will stop. Or if they don't have that reaction, maybe they're not somebody that you want in your life. So it's a really good starting point to start to understand yourself and then in turn, the things that you need and that you're looking for from somebody else. That leads us then into another important thing about relationships and about our relationship with ourselves, which is self-esteem. So self-esteem refers to the value that we give ourselves and the qualities we possess. So it's about appreciating what you have and understanding that no matter who you are, you have value and you have qualities. They mightn't be the same as, somebody you admire that we look up to, but that your qualities are just as important and that you can model those qualities of the person you like and aim to be more like them, but value the ones that you have in yourself. Self-esteem and those values we place in ourselves can influence our motivation. So, our desire to do things, maybe to even get up in the morning and go out, or well-being. So whether we're feeling okay about ourselves, whether we're happy, how our emotions are, how we're treating ourselves, so how we talk to ourselves in our head. So, a lot of the times kind of positive affirmations of saying things like, actually, you're a really friendly person and people are always happy to see you come in, versus that negative voice in your head saying, oh my God, I wonder, do they like me? No, sure, I'm a really boring person. I bet you they're all thinking, why is she here? So those internal kind of conversations can often actually impact our self-esteem and speak to us about our own self-esteem and what's going on in our brains. And all of that impacts on our quality of life. So it impacts on how often we're going to put ourselves forward, how open we are to meeting new people, doing new things, feeling that we're valued and worthy of a relationship, of being treated correctly, of looking for things that we desire and we want. And that's where self-esteem is so important. So people with healthy self-esteem then understand their skills. So if you have good self-esteem, you're able to look at yourself and think, actually, I have some really good qualities in myself that I like. So maybe I'm kind, maybe I'm compassionate, maybe I'm a good listener, maybe I'm somebody who goes out of their way to help others. All of those little things that sometimes we don't stop to think about in ourselves are actually really important because they build our own self-esteem and understanding of ourselves and the qualities that we have that are good. People with good self-esteem are able to maintain healthy relationships with others because they have a healthy relationship with yourself. So it's a really important thing to stress to people that when we talk about relationships, we often jump ahead to thinking about, what's the perfect couple? Who am I looking for as a partner? But in order to find that and to be sure of what you want, it's so important to have a healthy relationship with yourself, because at the end of the day, you're the person you're going to spend your whole life with. You're the person inside your head, and you're the person who's going to be in these relationships and searching for something. So that's a really important fact. Have realistic and appropriate expectations of yourself and your abilities. So often, like I was saying, we might have celebrity. I was saying that with self-esteem, have realistic expectations and appropriate expectations of yourself and of your abilities. So often people can jump ahead and, you know, pick out celebrities or famous people and think, I need to be just like them. I really admire that person. But it's reeling it back and maybe breaking down some of those things. So it might be somebody like, you know, a lot of people follow the Kardashians, for example, or and think, you know, like, oh my God, they're brilliant. They're always so positive. They are out there. They put themselves online. They're so, you know, comfortable with their own bodies in a way. But actually, it might be that it's their money and their lifestyle and things like that that people are actually seeing. So having a realistic expectation can be actually breaking it down and thinking, I actually just like the way maybe Kim has a good relationship with her family and that they all come together and they speak about certain issues that are coming up for them and they support one another. And just breaking it down into something that maybe you can bring into your own life, that I can't emulate their life in full, but I can take a little part of it and think I'd like to have that for myself. And then understanding their needs and able to express them. So that's a really important part of self-esteem, is actually understanding what you're looking for and then being able to tell somebody what that is. So be it a friend, a family member, or a partner, that if you understand what you need and what you're looking for, you can have a much better relationship with somebody because you can express it really clearly. Relationships come, I suppose, in all different shapes and sizes. And it is something that a lot of people aspire to or hope to have, that someday they'll have a really positive relationship with somebody. So again, just to highlight, your relationship with yourself is the most consistent relationship in your life. And it's the one that's going to impact all of your other relationships. So by having a positive relationship with yourself, you're much more likely to have a positive relationship with somebody else in the future. A healthy relationship with yourself will give you the ability to recognize the qualities and values that you possess and what you're looking for in a partner. So a lot of these pictures here are just some complementary couples who seem to have found somebody who really supports them, who values them for who they are, and also has qualities that are complementary. So it might be that your partner, if we look at the Obamas, because they're quite famous, you know, Barack Obama is very outspoken. He's very, you know, in the public eye. He had a huge persona as president of the United States. And he had a wife who shared the same values, the same beliefs as him, but was also there to support and encourage everything that he needed to do and didn't necessarily try to take the limelight, but created one for herself that was equally as positive. And they were very complementary of one another, and they continue to have a great and strong relationship. So we have loads of different examples of that in relationships. But again, it's knowing yourself and what you have to help you find somebody who's compatible with that. Healthy relationships and every relationship have ups and downs. So it's important that we're realistic with things as well. You know, often we have this idea that relationships are perfect, and even the most perfect relationships are never quite what they appear on the outside. Only the two people in them actually know what's going on. But if you find there's more negatives than positives in a relationship with somebody, it's a good time to think about whether or not it's a healthy one. And often we mightn't realize this is happening until we break it down and start to think about a particular relationship in our life. So what you should feel in a healthy relationship is positive and comfortable about yourself. So a relationship should never make you feel bad about yourself, be it how you speak, how you look, how you are, what you think you need, or any of your desires or dreams or beliefs in life. If you're with somebody and if you have a relationship with anybody, they should be a positive force and they should be confirming all of the things that you want to do. You should feel confident in that relationship and in yourself. You should feel loved, wanted, needed, and useful. You should have like views and opinions and feel that you're respected, even if you disagree with something. So being with somebody who has similar views and opinions means you're less likely to disagree because you're probably of the same, you know, school of thought on something. So if we take, you know, maybe the presidential election in the States, the pro-Trump campaign versus, you know, the Democrats, there was very different beliefs between Republicans and Democrats. So maybe they wouldn't necessarily get on that well in a relationship, or maybe that's something they can put aside. Only the two people know how that will work, but you need to be respected within that. And just having a happy, positive relationship is good for your mental health. So that goes for all relationships. So parents, family members, friends, boyfriends, girlfriends, it should always be that all of those things listed above, no matter whether it's a romantic relationship or just a friendly relationship or a family relationship, that people make you feel good about yourself, support you as a person, and build you up in all of the things that you want to achieve. How can you create a healthy relationship? So there's certain things we can do if we're getting into relationships that we can do to help make them more healthy. And one of the things is actually setting boundaries. And that is deciding what you're comfortable with and make sure that the other person understands this, that they share the same kind of understanding of how much time you want to spend together, how comfortable you are in the relationship, how comfortable you are with a sexual relationship, and that you can talk about all of that with someone. You can communicate. So that idea of talking, if there's a problem or something that's bothering you, it's really important you can bring that up and talk about it with another person. Likewise, if they want to discuss it with you, you need to listen to them. So sometimes, we might be pretending something will pass, but if somebody wants to bring it up, it's really important that we listen or they listen to us. Knowing when to walk away. So sometimes I think it's important that we just highlight this as well. If a relationship is making you feel down or anxious or affecting other parts of your life, decide whether it's something you can or want to work on. So sometimes you just don't want to put that energy into it, or sometimes you think, actually, I'll give it a try. And then if that doesn't work, I'll know for sure. And you can end it. This can be really difficult for people because you often still care about the person, you have feelings and emotions attached to it, but it's really important that you do what's best for you. So, never stay in something if it's not making you happy, and take that time. Maybe it's taking a couple of weeks to think about something, taking a step back and seeing whether it's right for you and whether you're feeling good in that relationship. There is no timeline. So it's really important to stress this, I think, especially when people are starting out in relationships or, having first relationships, that there's no standard dating timeline. So if you don't feel a romantic interest in anyone, or if you don't receive romantic interest from others, it can feel like it'll never happen. But that's not the case. That's just a passing moment in time. Or maybe you don't feel like you will be attracted to anybody, and that's okay too. You might be feeling like you're asexual, that you don't have that sexual attraction to somebody, and that's perfectly okay. So it's understanding that and being okay with it. It can be disappointing if your friends are starting to spend time with other people romantically, but this will happen for everybody if and when you're ready. And it might just be that the perfect person for you isn't there yet, but don't judge yourself or put yourself on the same time frame as others just because maybe they're starting. Don't be hard on yourself if you're not doing the same things as your friends. So it's not an indication of the rest of your life. And I think that's a really important thing to say. So the type of connections you'll have in the future, or your future relationships, will be totally different to probably the ones you're having right now. It won't feel like that, but don't be hard on yourself if all of the, romantic relationships aren't happening right now, or your friend has a boyfriend and you wish you had one, but you don't, or girlfriend. It's all about the fact that these things will come, and just being kind to yourself and enjoying the time that you have. Don't feel pressure to care about relationships and dating if it's not a priority for you. So this isn't a priority for everybody. And often we think it should be, or friends and peer groups will put pressure on somebody that they should be having a boyfriend, and why aren't they interested in somebody, or having a girlfriend, and you need to be online, or you need to be looking, and I think they like you. And that mightn't be something that you're interested in right now. And it's standing your ground and being okay in who you are and what you're doing, and saying, actually, I'm just not interested in that right now. It'll come for me. Now isn't the time. And that's knowing what you want. So when we think about relationships and knowing ourselves in general, it's all about knowing what you want and what you're looking for. So take that time to stop and think about what you actually want. Don't rush into sexual activity. So some people might have already been engaged in sexual activity, others mightn't. But if you rush into something, you can often feel hurt or confused afterwards. So we hear that a lot inside about people come in and say, everyone else said they were doing something, so I did it, but actually I don't think I necessarily wanted to, or I'm not sure about how I feel about it afterwards. So having unplanned sex also means sometimes people take risks. So they mightn't use protection like condoms, and they might put themselves at risk for pregnancies or STIs. Even if it's the first time, you can contract these. So it's really important that if you're thinking about having sex, that you don't rush into it, and that you wait till you're ready and think about all of the practicalities that go along with it, along with all of the feelings and emotions and desires to do it. Wait until you're ready and you want it for yourself. Masturbation can be a useful way to explore what excites your body. So if you're by yourself, maybe you're not in a relationship, maybe you're on a break between relationships, you're not looking for a relationship, masturbation is a great way to get to know yourself, get to know your body, get to know what you like, that you can then share that with a partner. And also you can self-pleasure this way. Masturbation is a great way to relax, to release endorphins. It brings down stress levels. That's been proven scientifically. And it's a completely natural and normal thing to do that often we don't talk about enough. So it's a good one that's there for you that you don't need to worry or need anybody else involved with to do. If you decide not to have sex, that's absolutely okay. Nobody should pressure you, and you shouldn't feel pressured from anybody to do that. So that leads us nicely into consent. So this is one of the big pieces we're going to cover today. So consent is a huge topic, and it's really important in all of the different relationships that we have in our lives that we understand consent, how to get consent, how to read consent, and how to know when consent isn't there, even if it's not verbalized. So what exactly is consent? So consent, by definition, is a mutual, voluntary, informed decision between clear-minded, of-age participants before any and every sexual act. Mutual, because every person that's involved must give consent. So everybody in the moment who was engaged in the sexual activity must say yes, that they want to agree. Voluntary, because you cannot give consent if someone is pressurized into agreeing. So it has to be somebody of their own volition. So without anybody pressuring them or forcing them, says, I want to do this. Enthusiastic. So it's really important that every person that's involved actually wants to be involved and isn't just going along with it for somebody else's benefit. So just because a boyfriend or a girlfriend might say, oh, I really want to do this, somebody mightn't be so sure. So it's really important that they're like, yeah, I absolutely want to do this too. And that it's enthusiastic and clear yes. And it's ongoing because you need to give and receive consent before, during, and after every act. So if somebody, say, is with their partner and they're kissing and they're thinking about moving on to oral sex, they need to get consent to move on to the next stage of doing something. And just because somebody has agreed to engage in oral sex doesn't necessarily mean that they want to move on and have full sex with somebody. So we get consent at every stage so that we know somebody is comfortable and willing to move forward and to be engaged in that act. There are legal issues then around consent. So in Ireland or law, we have a legal age for consent, which is the age that somebody can say yes and actually give their consent and it's recognized. So the age of consent in Ireland is 17. So legally in Ireland, when you turn 17, you can give consent to have sex, no matter your sexual orientation, your gender, and that's the same for no matter what that is for your sexual partners. So at 17, we can give consent to have sex. What if somebody has sex below this age? So often we hear of people having sex maybe at 15, 16, different issues come up around this, with relationships, and people are always wondering where the line is around it. So the law does actually recognize that younger people may engage in sexual activity with each other. So while our law by definition is that you have to be 17 to consent to sex, there is a proximity of age defense, or the Romeo and Juliet defense that sometimes comes up, which means that if somebody has sex with a person between the ages of 15 and 17, they can put forward this kind of argument so long as certain conditions are met. And they are that the age difference between the two people has to be 2 years or less. So you have to have somebody who's 15 or 17 or somebody who's 15 and 16. There can't be any more than that. So you couldn't have a 15-year-old and an 18-year-old, for example. The people involved must have agreed to the sexual activity freely and voluntary. So again, like we said, with the definition of consent, nobody can be pressured into it. People have to want to have sex and freely have said that they want to do so. And neither person must have felt exploited or intimidated. So nobody can put pressure on them, blackmail them, or make them think that they have to do this. And nobody can be in a position of authority. So it can't be, for example, that somebody is the head of a football team over somebody. So that would be a slight authority over somebody else on that team. Even things like that are technically a position of authority. So you could be bribing somebody with the, I'll give you, whatever position in goal if you do this with me. So that would be a bribe, and it's not somebody freely consenting to have sex. So our legal age is 17. There is the Romeo and Juliet defense. So there has to be 2 years and it has to be 15 to 17. And that's in place around that. So long as those two people have agreed, nobody was pressured. Now, there are some cases of people have been prosecuted outside of this. And in that case, they would potentially end up on a list of registered sex offenders, because if you have sex with somebody under the age of 17, they're considered a child. So it's just really important that you know this, that you know the ages that we have, and that people are really careful and make sure that they have consent, but also that they know the age of consent is 17 in Ireland, and that you're not meant to be having sex below that age. So knowing the facts then around consent. So when we think about consent, it's really important that we ask the person if they're okay before, during, and after sexual activity. So it's like checking in with them. So if you're having sex with somebody, you should be comfortable talking to them. And it shouldn't be a weird thing to ask somebody, are you okay? Are you enjoying this before you do something? Are you sure you want to do this during it? Is this good for you? Do you like this? And afterwards, I hope that was okay. Are you all right afterwards? And you're just checking in and again, securing that relationship and making sure that it was all right for somebody and that you did read those signals correctly. Checking in every time the new type of sexual activity begins. So especially moving from one type of sexual activity to another, it's just making sure that somebody is comfortable making that jump and wants to engage in it. Stop if the other person seems unhappy or unsure, or if you're unsure whether they're consenting. So that's really important. If you're not getting a clear yes from somebody, or you're not able to read off them that they're definitely saying yes, stop. If you've any uncertainty about something, just stop, ask. So go back to the beginning and think, actually, I'm just going to ask them straight out, are you okay? I'm not sure you're feeling this. Is everything all right? And make sure that you give somebody the opportunity to actually say it if they haven't maybe verbalized it, but you're not sure. Know that you and the other person have the right to change your mind and withdraw consent at any time. That's another really important one. You could be in the middle of doing a sexual act with somebody and change your mind about it, and you have the right to do so. So you can stop in the middle of anything that you're doing beforehand and say that I actually don't want to continue and walk away, and the other person has to stop. Or if somebody says that to you, you have to stop. So that's really important around consent. Can anyone give consent? So the answer to that is no. Some people just aren't capable of giving consent according to Irish law. So if they say yes to any sexual interaction, it doesn't actually count as consent. So these would be if you're not clear-minded. So for example, if you're drunk to the point where you can't think clearly, you might be intoxicated, you might be walking straight, thinking straight, you mightn't even remember it afterwards. So it's really important. If somebody isn't clear-minded, they actually cannot give consent. So even if they say yes, it doesn't actually count as consent. If you're not clear-minded to the point of incapacity, so if somebody is passed out somewhere drunk and they're like asleep or they're not moving, clearly they cannot give consent. If someone is under the age of 17, technically by law, they are unable to give consent. So even if they said yes, it wouldn't count as consent. If you are incapable of understanding the nature or the consequences of a sexual act, or incapable of communicating consent due to a mental or intellectual disability or mental illness, then that again wouldn't count as consent. So that person might not actually be able to give consent. And even if they say yes, they probably don't understand what they're consenting to. So those would be the conditions where somebody cannot give consent. Recognizing consent then. So if we just break down some of the kind of things that we can see when we think about what is consent, what does it look like, how am I sure that I'd have it? So what might you see with somebody? So when we think about somebody giving consent or not giving consent, we can use the same types of examples to see the difference. So is your partner responding to your touch? Are they not responding to your touch? So if you rub somebody's arm, are they smiling and moving closer? Are they actually kind of pulling away and they're not really into it? Are they pulling you in closer? So they're giving you consent, they want more, they want to be near you. Or are they pushing you away and they're trying to create that distance between you because they're not actually enjoying something? Are their arms open and welcoming? So, we talk about open body language when somebody, has an open frame to you, their arms are out, they want to kind of embrace you, versus are they holding their arms tightly around their bodies? Are they nervous? Are they kind of creating a barrier between the two of you, which might, communicate, I'm not really interested in this, I feel uncomfortable. Is somebody making good eye contact? So are they smiling at you? Are they looking at you in the face? Are they giving you all of the signals that they're really enjoying something? Or are they turning away and hiding their face and maybe embarrassed to be looking at you or feeling uncomfortable and just not saying it? Do they seem relaxed? So is somebody's body relaxed? Do they feel calm, that they're comfortable, they're not tense? Or are they really uptight and stiff and hard and it's awkward for them to move? Do they seem happy? So seems like a really obvious one. Is somebody actually happy to be there? Seems to be enjoying it, liking the experience? Or are they upset if somebody was crying or looking away or just seemed really down? that would probably suggest that they're not enjoying this and they're not giving you their consent. Have they said yes to the activity? So in hopeful terms, we are generally looking for an actual verbalization of a yes is the easiest way to indicate consent. So have they said yes? Have you asked? Have they said yes? Or are they remaining silent? So is somebody not saying anything at all? Sometimes that doesn't mean they're saying no. But if somebody is giving you all of these signals and they're not saying anything, they mightn't be comfortable saying it, but you can read it in other ways off their body. So it's really important to take account of these things. Do they seem enthusiastic and into it? So do they seem like they're enjoying it? Do they seem like this is something they're into, that they're thinking, yeah, this is great? Or do they seem that they're really uncomfortable and unenthusiastic and they're maybe a little bit nervous or off and it's not really seeming like the person that you thought they'd be in this interaction? Have they said maybe an excuse that they're feeling tired or sick? So often people mightn't be comfortable saying no for whatever reason, but they might bring up something else and say, actually, I'm just not feeling well right now. I'm feeling really tired at the minute. And they can be cues to somebody that they're telling you in a roundabout way that they're not interested or they're not enjoying something. Or is somebody changing the subject away from sex and trying to concentrate on other activities? So sometimes if you're, feeling in the mood and you're rubbing your partner's arm with their leg and you're trying to get them into the mood and they're changing the subject and saying, did you see EastEnders last night? That can be a very subtle way, but a very clear way of saying to somebody, I'm not feeling or in the same space that you are, and I'm changing the subject because I don't want to actually think or talk about sex. So there are some ways that we can actually notice consent, and it mightn't be all of them together, it might be one, but just hearing them or knowing what it is that you're looking for can be a really good way just to notice, is somebody giving me consent or am I assuming? And stop in your actions with people when you're with them and be comfortable to ask them and look for these signals. And if for any reason you're unsure, you think actually some of those seem like the ones I remember from that webinar of somebody not giving consent, just stop, just ask them. If it is a yes, you can get back to the activity. Someone will say, oh no, actually I was really enjoying that, sorry, I didn't mean that, you read that wrong, and it won't change anything. But if somebody is actually uncomfortable and maybe just hasn't said it, you can pick up on that and not get any further down the line or make somebody uncomfortable. Alcohol, sex, and consent then is another important piece to talk about because alcohol and other drugs affect people's decision-making abilities. So a person who is highly intoxicated or, really, really drunk is not able to give consent. And it's really important that we realize this. So even if somebody can verbalize a consent, if they're highly intoxicated, they can't actually give consent. So alcohol in general can affect people's ability to make decisions, and that includes the decision to partake in sex. So taking drugs and alcohol can often, what they say, lower our inhibition. So we're much more likely to make more risky decisions or agree to things or do things that are slightly out of our personality or our normal comfort zone. So we might do things under the influence of substances that we would never do in person on a normal Tuesday afternoon. And that's why we need to take account of when there is alcohol or other drugs involved, the consent isn't as clear as it would be otherwise. If a person is completely intoxicated or out of it due to drinking, they just are not able to give consent. It's very black and white. It's an absolute no. Non-consensual activity then includes anything from kissing to sex and is against the law. So if somebody doesn't give you consent and you kiss them or you engage in any type of sexual activity with them, it's against the law. And sexual activity with somebody who doesn't know what is going on because they're intoxicated or unable to consent is considered to be a sexual assault or rape. So this is why it's really important that we just mention this on touching the subject, because alcohol and drugs can make the whole issue of consent quite murky. And it's really important that we just know that if somebody is intoxicated or out of it due to drinking, they cannot give consent. If somebody isn't going to remember, or if they're really, really drunk, they are not in the clear position to give consent. So it's just really important that we keep that in mind. Bystander intervention then is something which some people, I think on the webinar, might have come across before, but it's something we're seeing more and more of as an initiative to kind of bring up to people of what you can actually do if you see something like this out and about. And it's a really, really great thing. So what is bystander intervention? Bystander intervention is recognizing a potentially harmful situation or interaction and choosing to respond in a way that could positively influence the outcome. So if you saw somebody who was highly intoxicated and somebody came along and you thought they don't seem to be reading that for what it is, or they look like they might be taking advantage of that person, and I'm not sure that they know what's going on, the person who's intoxicated, or that they're safe. It's what you can do as a bystander to maybe intervene or to change that situation and to help somebody. And everybody can help, it can be anyone. And it's really important that if we see these things, that we don't be a bystander, that we actually think of how can I help this in a safe way. So if not you, then who? And this is a really important thing just to note for people. So I think often when it comes to things like this, we don't actually think of, I suppose, the research, which can seem boring around it, but like what actually goes on. And research has actually shown when they look at kind of group interactions or people seeing things and whether they intervene, that alone, so if you're by yourself, people will help 80% of the time. So if you were walking down the street by yourself and somebody dropped their phone in front of you, chances are you'd pick it up and hand it back to them. In a group, so if there was 5 or 6 people walking down the street together, chances of people actually noticing or being the person in the group to step forward to help and pick up the phone is much lower. So in a group, somebody will help 20% of the time because they're waiting for somebody else to do it. And that's what they call diffusion of responsibility. So everyone thinks that, well, somebody else will do it. Fine with these 5 other people and none of them has stepped forward to do something. Why should I? And if they don't help, then I don't have to feel guilty because nobody else did either. So alone, we're much more likely to feel like we can step in or intervene, but with a group of people, we're less likely to do so. And if we think of situations where people might find themselves in a compromising, situation around consent, it's often at parties or maybe in bars or, in a position where somebody has been drinking alcohol, which is usually in a group. And therefore, that diffusion of responsibility often exists in those situations. So we're just going to have a quick look at this bystander intervention video. And it's just going to show us different scenarios. So it's going to paint us a picture of an issue where somebody maybe wasn't in a position to give consent. And then it's going to flip back and show us all of the different bystanders in the room and how potentially they could alter this situation. So it's just a really nice way to present this and show you what bystander intervention is.
Hey, where are you going?
I think I just need to lie down.
That's okay, we can find someone.
Sorry, excuse me. Can I... Oh, I'm so sorry. Do you... Toilet and sort it out. Yeah, come on.
Mate, it's time for you to leave. Do you need a cab? Good, thanks.
So that is just a quick video And I think it's a really interesting way just to show really subtle things that people can do that are comfortable for them. So the first girl saw it and she thought, I can just get her by herself. So I'm going to just gently spill a drink on somebody, which can be a pure accident. Nobody can think that it's necessarily something that you're intervening on, but it gives you an opportunity to take the person aside, to check in with them and make sure that they're all right, make sure that they are in a position to be comfortable and that they are capable of giving consent. The second people thought, okay, actually, we're going to leave. Let's just take her home with us. We'll just, this is a friend or somebody I potentially know, but as a big group, we can just take this person along and take them out of this situation because I don't think that it's a good situation to be in. And the last person was more comfortable confronting the person straight on and saying, what are you doing? I'm seeing something here that I don't think is great. So I'd be really interested to hear what you guys think of that video and the different steps that people took around it. So if you want to pop some comments into the chat box, we might look at them at the end as well, as to whether you think they're good strategies, whether you think they're things that people could use in person, if they're things that, you could roll out in real life. Because I think sometimes just having those little tidbits of seeing what somebody else might do can be really useful in the moment, because we're not always sure ourselves what we can do. And it's really important that if we do think about doing anything, that we do it safely. So never confront anybody if you're not sure that it's a safe thing to do. So if we look at 5 steps to helping in a problematic or potentially problematic situation, they are noticing the event. So the first thing is actually, people are often busy, distracted, on their phones, they're talking, they're texting, they're not aware of their surroundings, they might be with friends, they're busy laughing and having a great time. And sometimes they just don't want to notice, they don't want to worry about somebody over there in the corner by themselves. But actually just taking that minute to look around and make sure that somebody is all right can make the biggest difference. Interpret something as a problem. So it can be hard to tell if somebody needs help. So you might view something and think that it looks wrong. And actually, when you investigate or get close or actually go up towards somebody, you can see that actually it's completely fine and you read it wrong from a distance. But it's actually taking time to interpret it and look at the problem and see if everything is okay. And not feeling embarrassed to ask or feel the need to conform to peer pressure. So again, just because friends aren't maybe stepping in, don't feel that you can't be the one to start that and to step in. Assume personal responsibility. So if not you, then who? So don't always think that somebody else will do something. So as we've shown with the research around groups, often people are always waiting for somebody else to be the one to step forward. So taking that personal responsibility of saying, actually, I'm going to do something here, maybe bringing that group of friends with you if you're in a group and saying, actually, I'm seeing something there. Come on, guys, let's just have a look, and have that courage and confidence to be first. Know how to help. So again, never put yourself in harm's way. So don't confront somebody if you think they're going to get violent or it's going to turn back around on you in a negative way. There are other things you can do, like potentially calling the guards or doing it from a distance that's safer. Implement the help, so act. So that act, as I said, can be anything from spilling water to offering somebody a lift, to confronting somebody, to calling somebody else. So calling an authority, taking a video of something if you're not sure of it so that you have some evidence, whatever it is, just taking an act or making a step to implement some help. So they are all of the ways as a bystander outside of a situation where you're not sure consent is happening or that somebody might be in danger, that you can actually help. And it's really nice to think that if you were ever in that situation, that somebody might step in and help for you, and also that you can do that for somebody else, and it might make a huge difference to their experience. That leads us into something that I know we touched on a little bit last week then, which is sexting. So in regards to relationships and consent and all of the things that we've been kind of leading up towards, when, and especially nowadays with COVID-19 in the world that we're living in, when you're in a relationship with somebody, especially in the middle of a pandemic, sexting is a very normal way to communicate with somebody, and it's become hugely popular. So what is sexting? So sexting involves sending and receiving sexually explicit or nude or naked pictures of somebody. So you might be sending, you might be receiving, and it's a way people are kind of engaging in sexual acts at a distance, virtually, potentially more safe during COVID-19. While sexting is intended to be private, sometimes these sexts end up being made public or shown or shared with other people, and it's caused a lot of distress for some people, and it's an issue that really needed to come to the fore, and it actually only happened in February that new laws came in around intimate images and this sending and protections for people engaging in this type of act. So firstly, I suppose we can look at why people engage in this. So why do people sext? So sending or receiving sex can be a turn on. It's a way to feel intimate with another person at a distance. So you mightn't be there in person, but you can still have a close relationship with somebody in a virtual manner. People feel that sending a sext will make somebody like them more sometimes, but if somebody is worth your while, they will like you whether you send them sex or not. So I know this has become an issue for a lot of people, saying that they're under pressure from partners or people that they meet that they should be sending sex, and if they don't, sure, another girl down the road will, and so I feel I have to or I'll lose somebody. And it's really important that people think about it in the sense of that value and that understanding yourself and your self-esteem, that if you want to sex somebody, absolutely do, but you should never be under pressure to do so. So if you don't feel comfortable or you don't want to send it, don't do it because somebody is pressuring you and telling you that they'll get it off somebody else. They're not worth your while. So if somebody isn't willing to wait or for you to be comfortable, let them off. And again, it's knowing when to walk away. Maybe you're both aroused and far away from each other and therefore decide it's the only option available to you at a moment in time. So again, I think this is a huge thing for people in the last year. And a lot of the time people are using dating apps like Tinder or Grindr, and the person they're sending the nude to is somebody they've never met to or chatted before. So that's been a huge thing. Again, when people are meeting online or meeting virtually because they're not out and about, often they're more likely to sext, and it feels, I think sometimes people have described it as a little bit more anonymous, that somehow they're sending this into the ether to somebody they don't know. But the impact and the problems that come along with it can be just the same. And it's really important we understand that. So this pressure to sext then that exists. So it's really important just to remember you don't have to if you don't want to, and never feel pressured into it. No matter how much you like the other person or how much pressure they put on you, if somebody respects you, if they care about you, they'll completely understand. And if they don't, it's even more of a reason not to share one with them. So if somebody isn't willing to wait or understand that you don't want to, is that really a person you want having your intimate images? If you're in a situation that makes you uncomfortable and the other person keeps asking you for sex, don't be afraid to block them. So especially online, if it's anonymous, if you don't know who that person is, don't be afraid to block them and to take that out of your life. You don't need to feel uncomfortable ever, be it in the real world or be it online. So there are some questions that we just recommend people ask themselves before sexting or before engaging in it, just to make sure that they're comfortable and they're sure that this is something they want to do. And those are you confident and secure in sending the text? You're not even thinking about it. You know that you want to sext this person and that you're secure and confident in doing so. Do you trust the person that you're sexting? So do you trust that person with your images? Are they somebody who you want to have that image of you and you think that it will be safe with them? Will this person be comfortable receiving a sext? So often this comes up a lot of the time. We hear of people getting dick pics or things like that. And often it's really important that we don't just send naked pictures to somebody without them actually being sure that that person wants to receive them. So it's not okay just to send somebody a picture of yourself unless you're sure they actually want it. Selfie awareness then and legal issues. So when it comes to sexting, there are some things that it's really important that people know. So when it comes to being under the age of 18, sending a naked image of yourself is actually illegal. And this is something a lot of the time people don't think about. So possessing, so actually having a naked or explicitly image of somebody under the age of 18 is illegal, or sending it is illegal. If someone sends a sexually explicit image of someone who is underage, so even if it's yourself, to somebody else, they can be prosecuted for the distribution of child pornography. So you're essentially sending a naked image of a child to somebody. So be it that you're doing it yourself or be it that somebody else is sending it, it's not okay. In Ireland, the age of consent, as we said earlier, is 17, but the legal age to appear in pornography is 18. So they don't actually line up. So although you can have sex with somebody at 17, a naked picture is an image, so it's a pornography type, you have to be 18. So there is a difference there, and it's really important that people keep that in mind. Anybody below the age of 18 is considered a child for the purpose of pornography. So any images, videos, anything like that is considered child pornography as somebody under the age of 18. Image-based sexual abuse then is also known as revenge porn. And so when it comes to being able to send an image of yourself to somebody, so if you're 18 or over and you decide that you want to send an image to somebody, that's absolutely your right and you should be able to do so and receive it. But sometimes these images have been used negatively and people have found them, shared online or posted places that they shouldn't have been. And it's caused a lot of distress and hurt to people. And this was termed revenge porn. So intimate image abuse, as we know it, is often referred to as revenge porn casually. But that word, I suppose, just to say it as well, isn't often used or liked. So revenge suggests that somebody did something wrong that you have to get revenge on them for. And most people who have had an intimate image abuse of themselves shared have never done anything wrong other than send that image. So intimate image abuse or image-based sexual abuse is a much better term for that, but you'll often hear it referred to as revenge porn. And it's the act of sharing or threatening to share intimate images or videos of somebody offline or online, but without their consent. So that person didn't want that image going beyond the person they sent it to, but it has gone out somewhere into the ether and been shared, and it's not okay. Young people, 15 to 29, are most likely to report being threatened by intimate image abuse. So that's a really interesting statistic. So 15 to 29-year-olds are most likely to report being threatened by intimate image abuse. Young people 18 to 29 are the ones who've actually had those posted publicly. Men and women are equally likely, so it doesn't matter whether it's women or men, both have had an equal number of non-consensual images posted online. And LGBTI plus people are at much higher risk than heterosexual people, with 17% of LGBTI plus internet users threatened or actually had pictures posted of them. So they're just some of the data around this intimate image abuse. And that's what brought about this law. So it's a little bit scary, I suppose, in a way, but it was actually only in February of this year that this law came into being. But it's really important that we know about it so that if you are sharing images or if you see images around it, that you know the law, you know how you're protected, and you know what you can and can't do with somebody's images. So the Harassment, Harmful Communications and Related Offences Act, known as Cocos Law, was first brought forward in 2017 following the death of Nicola Fox. And the act was signed into law in December, but it actually came into force as of the 9th of February this year. So as of the 9th of February, somebody can actually be prosecuted for intimate image abuse. And what that means is if somebody distributes somebody's intimate images without their consent with the intent to cause them harm, so somebody has the image and they want to hurt them, it is punishable by an unlimited fine, so any number, and up to 7 years imprisonment. So that's quite a serious offense. So if somebody intentionally goes out and shares an image of somebody that was sent to them, they can be punished with an unlimited fine or 7 years in prison. And if they do so with no intent to cause harm, so maybe somebody just decided to share it on, they didn't know who was in the image, they didn't really think about it, they just thought, I'm going to share this on, doesn't mean anything to me, but I'm not going to stop here and I don't know this person or whether they've consented to it. That is no specific intent, but they are still causing harm, and that's punishable by up to a €5,000 fine or 12 months imprisonment. So if somebody sends images to somebody and that person decides to share them or spread them without the consent of the person whose image it is a very serious offence now in Ireland. So do not do it. And if you ever do have that happen to you, know that you are protected and that these are the punishments around it. Other factors then that come along with this law are if the person sharing the image has been in a relationship with the victim, that will be considered an aggravating factor in the court, which is a more serious factor. So if your ex-boyfriend or ex-girlfriend shared your image to hurt you a year after the relationship ended, that would be taken as a more serious factor in the punishment. That person had known you, had been in a relationship with you. So that's not just a stranger or somebody out to hurt somebody, that's a malicious intent to cause harm. Also, it's irrelevant if the person consented to the image being taken, and that's really important. So if you're in a relationship or if tomorrow night you decided to send an image to somebody and you're consenting to sending that image, you are not consenting to it going beyond that interaction. And that's why it doesn't matter in terms of the law if you consented to sending the image, because you consented to it in that context, but you never intended that to be sent to anybody else. So that is taken account in terms of this law. So it's really just a safety buffer and a blanket around this is happening, this is how we communicate. Sexting is a very normal part of life nowadays. Everyone engages in it in a lot of different ways. but knowing that you are safe, there is a law there around it, that your images are only to be shared with those you choose to send them to. And if they are ever shared or spread beyond that, that there is a law there to protect you that will cause punishment to somebody who goes outside of that agreement. Other information then about intimate image abuse is if somebody does share images of another person without their consent, there's a couple of things you can do. So obviously you go to the guards and report it. You can also ask the person to delete it. So if somebody shares your image on a platform, or if they, hold on to something on their phone that they don't want to, or that they have it, ask them to delete it. If the image is shared on a social media platform, report it. So you can report it to Instagram, Facebook, any of those, and ask for it to be taken down by the platform, that it's your image and you did not consent to it being used. There is support for people. So it's really important to acknowledge that intimate images being shared can be really distressing for somebody, because obviously it's a really personal and intimate act. So usually a sexual act is between people. It's not out in public for everyone to see, but having the images that somebody has shared privately with somebody shared online can feel like they've been exposed to the world in a way, and it can be really difficult for people. So offering support and linking people in with services, be it a friend, a family member, yourself, just reaching out for help and knowing that there are places who can, offer support and seek out answers. Like in the sexual health center, we're always there. We have a helpline if anyone ever wants to call, or the Instagram page that I mentioned at the beginning, the Sexual Health Hub. Just reach out if you're ever suffering with any of these kind of things, and there are loads of people there to support and help around that. There are online supports as well. So hotline.com offers a confidential reporting for images of sexual abuse or child sexual abuse. So if you ever see an image that you think is somebody under the age of 18, if it's shared to you, you can go to hotline.com to report it, and it will remove that type of imagery from the internet and protect the child's identity. So it's just a really good one to know about, that if you ever come across something that you're not sure that makes you uncomfortable, just report it. It's better to be safe than sorry, and you could be helping somebody out and getting an image removed. So that is everything in today's webinar. So we have talked about relationships, emotions, self-esteem, consent, bystander, what you can do as a bystander. We've talked about sexting, really normal thing that it is nowadays in the world that we live in, and intimate images and the laws in and around that to protect you. So I hope that gives everybody a good idea of all of those topics. But if anyone has any questions at all, you can just pop them into the chat box and I will do my best to answer them.